Today we are going to discuss more about the very important topic which is related to the all women's health, that is the pelvic floor dysfunction, and what are the symptoms which we can understand about these symptoms so that we can easily interact with our gynecologist and explain what are the pain we are feeling and what are the feeling which we are suffering. So these are the symptoms that is very importantly start with the UTI tract. These are the urinary frequency. You have to urinate in a very short interval. Urgency, you have to urinate. And the incontinence, you cannot control your urine pressure. That is called urinary frequency, urgency, and the incontinence. Then the fecal incontinence, you cannot control your pressure of your stool, so you have to pass the stool also. And the leakage of urine, that is also a very major symptoms while sneezing, jumping and running and coughing, the urine leaks. And as well as the constipation, that you have a feeling that you are not able to complete your bowel movement. That is, in short we can say that is the IBS, the irritable bowel syndrome. Pain all around in your genitals organs, that your genital organs, you feel pain, heaviness, burning sensation, irritation, itching. These are the symptoms which, because of these pelvic floor dysfunction, the women's faces. And there is a pelvic organ prolapse also, like your uterus, either your uterus is prolapse, or your bladder is prolapse, or your rectum is prolapse. As well as there are so many things related, that low back pain is also related with pelvic floor pain. And the main thing which we suffer with the tightness in that pelvic floor muscles, we when we are in a sitting position, we cannot sit properly because we are not feeling comfortable in the sitting position. And as well as there is the one major symptom, that is the endometriosis, that is related to the menstruation cycle, in that the thickness of this endometrium plays a very major role for the menstruation period. And as well as the newly married girls who are going to conceive, and the breadth of this endometrium plays a very major role in that also. So these are all the dysfunction related to pelvic floor. In this, there is so many terms we can: the low back, groin discomfort, pain in bladder, reduced libido, and discomfort in sitting. So these are the things which are the dysfunction of pelvic floor. So if you are suffering with these type of symptoms, so don't ignore your health, and please go to your doctor and consult. And as a physiotherapist, we have also so many things that we can help for the pelvic floor. If there is a muscle spasm, we can give the treatment for myofascial treatment to release these muscles, so that the patient can feel a very easy way in a sitting or their working. So this is there are a very great role of physiotherapist also in this pelvic floor dysfunction. Thank you so much.